Good evening. I'm Susan McKernan from Preventive and Community Dentistry. I'm in the Health Policy Research Program. And my colleagues and I are interested in trends in Iowa's dentist workforce supply, including demographic composition and geographical distribution. We're interested in changes that can potentially impact people's ability to get dental care when and where they need it, without having to drive for hours or wait excessively long periods of time. Dentistry as a profession is concerned with over and under supply of dentists. If there are too many dentists in an area, then there won't be enough business to support their practices. However, if demand outpaces supply, then dentists can start to get choosy about who they accept as patients into their practice, and what we see is that the people who get squeezed out tend to be the most vulnerable. Tonight, we're going to look at changes in dentist workforce at the city level in Iowa over a 20-year period, from 1997 to 2016. And to orient ourselves, we're going to start by looking at Iowa's 99 counties, which are categorized here using rural-urban continuum codes. Okay. Metropolitan counties are in gray, and those are counties that have populations of at least 250,000 people. Green counties are non-metro areas, and darker shades of green indicate increasingly rural areas of the state. Okay, now I've added a lot of black dots to the map. And these are cities in Iowa where we saw no net change in the number of dentists that worked there over the 20-year period. These are all active dentists, all specialties working in any setting, so private practices, community health centers, academic institutions. Sorry, I was distracted by the timer. So right now, we're just interested in general trends, so I'm not going to give you more precise information about how many dentists are in each city. But in general, in 2016, there were about 1,500 dentists in the state. Over the 20-year period, approximately half of the cities, I'll go back to the dots, approximately half of the cities in Iowa had no change in the number of dentists, okay? 1/4 of the cities in Iowa experienced a net gain in dentists. So those are represented by blue triangles here in this image. Now I've got red triangles showing us communities that had net loss in the number of dentists over a 20-year period. Okay, so this is a combined image that's showing overall gains and losses. And this is the image that piqued our curiosity. And what we're seeing here is a substantial shift in dentist practices from small towns and rural areas towards cities and suburbs. And although this mirrors the overall population shift in the state, we're concerned because we know that over the next decade, dentists from the baby boomer generation, who are overwhelmingly represented in Iowa's dentist workforce, are going to start retiring more. And right now, 42% of dentists in rural Iowa are over the age of 55. Thank you.